And this is where we teach you to have self-confidence and take control of your self-care through purposeful foam rolling, okay? So that's what the whole purpose of this is that you take control of your self-care. Part of that, and one of the things we did in the community, we were talking about how sometimes we get focused on one area of the body, and I want to try to explain to you why it's so important to work the whole entire body instead of just one certain area that we're having. Maybe we have tight hamstrings, we just specifically focus on the hamstrings. Or maybe our back is tight and we just focus on the back. So self-care is about a whole entire body. I'm not saying you have to do the body every day, but you need to be, throughout the week, you should be hitting pretty much the whole entire body throughout the week. So let me explain to you one of the things that has a big impact on our hip, and I think this will bring this home. As I'm talking, I want you to think about Mr. Mandy's hip here as a teeter-totter, okay? And you know, in a teeter-totter, we have that center point that the board teeters on right at that point, right? Well, if we think of Mr. Mandy's hip as that center point, and the two kids on either side of the boards are the back of Mr. Mandy's leg and the front of Mr. Mandy's legs. And we're talking about the hamstrings in the back and a group of muscles in the front called your hip flexors. And we're not going to talk about all the hip flexors, but just a couple to give you an idea, okay? So it's the hamstring in the back, that is one kid on the board, and the hip flexors in the front that are like a kid being on the other side of the board. And right here is the center of the teeter-totter. So let's talk about these muscles real quick and how they have that, why they would have that impact, okay? So let's take Mr. Mandy and move him over here. We're going to pull his shorts up a little bit, and I hope you can see a little orange dot right there. That little orange dot is a bone called your ischiotuberosity, and that's where the hamstrings are attaching to. It's a bone on the hip that the hamstrings come up and attach to. And all three of them do. And your hamstrings are big and powerful muscles. So if they're tight, they're not just, we feel the tightness here, but when muscles are really, really tight, they're going to have an effect on where they're attaching at, either down here where they attach or up here where they attach. So today we're talking about the impact that they could have up here at the top of the hip. So again, hamstrings are tight. They are typically tight because we sit a lot. So I'm gonna stand up and I'm gonna bend my leg. This is a normal position when you're sitting. Your hip is like this, right? And your knee is bent, and this is where you're sitting. So your hamstrings back here are shortened. These muscles are shortened because the knee is bent. If I straighten my leg out, the hamstrings are stretched out, and it's the quadriceps that tighten, okay? So if you sit a lot, then your hamstrings are going to be shortened, meaning they're going to be compressed or shorter, and they're going to pull here. So what happens when we have very, very tight hamstrings over a very long time? Well, it's going to pull here. So what happens when it pulls here? Well, I can't show you on Mr. Mandy, but I can show you on me. So let's say I sit a lot, my hamstrings are tight, and it's pulling on that bone right there. It can force my hips downward and actually pull them inward. We call this posterior rotation. The hips are being rotated and the butt is being posteriorly rotated downward, and it makes your butt disappear. It was I don't know if it's talked about much now, but I just remember growing up that as the men in our family got older, their rear ends disappeared, their butts disappeared, and it was just the joke of the family, I guess. And a lot of families, a lot of men, when they got older, back in the 50s and the 60s, maybe early 70s, their butts disappeared because they were sitting more than women were. They were driving from the suburbs into the city. They were sitting at their office all day, and their hamstrings got tight. And so they became the first ones to sort of lose their butts, right? But now we start seeing that more because when men and women are driving more. And so now we're starting to see a little bit more of the butt disappear because when these hamstrings get tight, they can pivot that the butt. Let's see if I can do this here. Backwards. Or posterior tilt. This is what it's called, a posterior tilt. And it's going to pull the hip that way. Just like that. I don't know if you can see that green line, but it's forcing the hip to be rotated and tilted posteriorly, making the butt disappear, okay? The opposite side of that, so let's say that was the case, and we just beat our hamstrings up, stretch them, work them, got them better, right? Which is not a bad thing, but what if we were also tight in the front, right? Or we created another problem because we loosened this, and maybe we tilted things back the opposite direction. And what happens there is if we have these muscles, so right up here is the front part of your hip, where these hip flexors, these big ones, come up and attach. And there's 3 of them that attach here. There's a muscle called serratus, that's on the inside. It comes up and attaches onto that bone. This large quadricep in the front, in fact, it's the only one that comes up and crosses your hip. Rectus femoris comes right up, attaches to that bone. And then your IT band comes up, turns into a muscle, the TFL, and it also attaches right on that bone. So again, these can be tight. And if they're tight, it tends to force the anterior rotation of the hip. So we'll rotate Mr. Manny around here like this. And we're going to use orange this time. And the tilt could be, or would be, more anterior. That direction. Okay? And what does that look like? Mr. Manny out of the way here. So let's say that I have that anterior tilt. So my hip would be forced outward. We call this the Donald Duck walk. Okay? And you'll see the butt stick out like this, and there's much more of a bigger arch in the back. And that's the kind of the walk. It looks just like that. The rear end sticks out, and we have this arch in the back. Anterior tilt of the hip caused by the muscles in the front. So again, if we have this battle going on between the two, we want to make sure we work both so that we are balanced, because we want the hip to be where it's naturally supposed to be for your body. And that's why we want to make sure we work both the back and the front, so we don't create an imbalance if we just work on one side. Okay? So that's how these two muscles interact to affect the hip. Either one of those, anterior tilt or posterior tilt, is going to put a great deal of stress on the hip and the back. So you remember when I was tilting my anterior tilt and sticking my butt out, you notice I have a much bigger arch in my back. That's not a good thing to have. The other way sort of straightens out the back a bit when we have the rear end disappear like that. It kind of forces the back into a much more straighter part. And again, that puts a great deal of stress on the back. And anytime we're tilting this hip out of position, it's going to have wear and tear. It's not in the correct place that it's supposed to be. That means it's going to wear out over time, quicker over time. So again, that's what we're talking about. The same thing would apply with the calf muscles, the shin, the muscles in the front of the lower leg, the inside of the leg versus the outside of the leg. We always want balance. We don't want to just work on one specific area and forget about everything else. Okay? So I hope this helps give you just a general understanding of why it's important to kind of do the whole body and work getting everything flexible and mobile so it will move, so that you are entirely flexible and mobile, not just in one area. Okay, and that's why you need to understand and foam roll with purpose. Okay, this is Brian Hagan from Your Healthy Steps. Have a great day and take care.